This is lab 9 in the cat specimen, and just like the dog, we're finishing up with the epaxial muscles and then flipping over to the right side to do some vessels and nerves. Alright, today we've clipped back the serratus dorsalis, cranialis, and caudalis, just like the dog was shown. And here we have our three systems. So we have iliocostalis, longissimus, and transversospinalis systems. If you like the mnemonic, you can use that. If not, I'm okay with that too. So iliocostalis, we have similar to the dog, but a little bit harder to differentiate the pieces sometimes in the cat. They all kind of blend together and look the same. So the lumborum, iliocostalis lumborum, is going to be here. Fused, very fused. Not as fused as, more fused than the dog. The dog looks like it has more pieces, but this one is all fused. Unless you cut this open, which you don't have to do. So, lumborum. Then we have iliocostalis thoracis. So, again, the tendinous parts kind of show you where it's going to the ribs. So it'll be right there. And longissimus sometimes is pretty hard to differentiate where cervicis is separate from thoracis at lumborum. So kind of about here is where I would say thoracis at lumborum would go. And that goes all the way down. So longissimus, thoracis at lumborum. And then you have the cervicis component of longissimus, which will be here. So this would be cervicis. And then again, you want to lift up that edge of splenius just a little bit and see that capitis, longissimus capitis portion going up towards the head. Okay, then transversospinalis, we have the splenius that's been cut and reflected up. And then we have the semispinalis capitis all together. And then you have biventer, cervicis is this piece, dorsally. And then complexus, a little bit more ventrally. And those make up semispinalis capitis. In the cat, no nuchal ligament, so you don't have to look for that in there. All right, now we'll flip the kitty over. And look at some of those vessels and nerves. So again, your little scissors are going to be your best friend on doing these vessels and nerves. And in the cats, it's usually a little bit easier to palpate that wing of the atlas when you're starting. And so then you just dig down in there and look for a nerve coming out. So here is that second cervical nerve giving off the transverse cervical, which is this little guy here, and then the great auricular going up towards the base of the ear. So second cervical nerve. And then we had the external jugular vein and the mandibular lymph nodes that we looked at. So external jugular vein, and then the mandibular lymph nodes here on either side of that linguofacial vein. Then you cut your sternocephalicus muscle, just like in the dog, and reflect that. Oops, that was not sternocephalicus. This is sternocephalicus. So sternocephalicus, cut and reflect. And then if you look down, if I hold that, you can see your medial retropharyngeal lymph node right there. And then you're going to cut and reflect brachiocephalicus, which was the other piece that I moved. So you're going to reflect that up and look for your accessory or 11th cranial nerve that's going across transversely here. So here was C2 coming out. So then this one going across that field is the accessory or 11th cranial nerve. So here it is going across, going back towards trapezius back here, all the way along there. So accessory or 11th cranial nerve. All right, and then we have the superficial cervical lymph nodes you should find, which again are under that omotransversarius. I can see them. So right in there, little oval right there. And then you are looking for those other branches of cervical nerves. So here was C2 coming out. You lift up omotransversalis and look for some more branches. So it looks like here would be C3 coming out, C4, and then back here would be C5, right there. All right, and I believe that's it. Oh, sorry, vagosympathetic nerve trunk, can't forget that. That should be pretty easy though. So right next to your carotid, it should be the big white nerve right there, going down next to your carotid artery. And that should be it for Lab 9.